So, Sean, it is National Diabetes Awareness Month. Uh, I have so many questions for you about what does the state of our industry look like when it comes to innovation around diabetes? But before we really get into that and your coverage with it, I was hoping to better understand like why have you dedicated so much of your journalistic coverage to diabetes and what was that there for you?
Full disclosure, happened by accident for the most part. Basically, our chief editor, Chris Newmarker, asked me in, 2021, I believe, to sort of revamp or revitalize our drug delivery business news website. And with that, insulin pumps are sort of the main draw of that. And I sort of almost transitioned drug delivery into a diabetes related website and outlet. Now CGMs are included on there, even though they don't deliver drugs. That's a little, I suppose, cheap by me, but it's all sort of part of the automated insulin delivery system. So yeah, basically when I was tasked with that a few years ago, I began paying more attention to the industry, and then slowly but surely you start to develop contacts and figure out who the big players are, and who you should be talking to and what you should know more about. Now I would certainly call myself far from an expert, but I definitely like to dedicate a lot of time to diabetes.
So you said this coverage kind of started in 2021-ish?
January of 2021, I believe.
Wow, so very specific. I mean, I think that in nearly 4 years, because we're at the end of 2024, I mean, you've probably, one, gained more interest in the subject matter, but have any takeaways or lessons learned or, hey, I didn't know this, more people should know this. Like, do you have anything like that?
I mean, I suppose it's just sort of ignorance on my part in my personal life, but just not really having anyone immediately close to me with diabetes. I never quite saw the toll that it takes on people. So sort of being able to cover this industry has taught me so much more about how vital some of these technologies and innovations are in terms of keeping people alive. As crazy as it may sound, these day to day, some of these devices are as integral to your life as a cell phone or a laptop or something you carry around with. These are devices that people wear every day that have to be right and have to be accurate and have to work, and that it's pretty incredible.
I think the key word you're using is like it has to be. I mean, I think that communicates the responsibility we have in our industry and for us as journalists in our industry to communicate the vital nature of this space and how to innovate and keep patients and caretakers able to take care of themselves and to take care of again their patients and kind of going round and round because it made me think, Sean, about you had communicated that you don't have really a lot of personal connection to diabetes. I remember when I was 12, my mother and father sat me, and I have three older brothers, around the table, and my dad had shared that he had type 2 diabetes. And we didn't understand what that meant. And I don't think we ever really understood what that meant. And that, when I kind of reflect on my childhood, that was this like go no go moment in our lives where I really feel like my father changed. And like I wonder if I had information, like if I really understood the gravity of what he was going through and had better awareness around what the difference is between type 1 and type 2 diabetes, what the possible interventions and technologies out there to help support him. I wonder if I would have been better able to empathize with his situation and better support him. Do you find that you're as you're interviewing key opinion leaders in the space and hearing these stories, like, do you find that that's a common theme?
100%. Honestly, I couldn't tell you the actual number, but I would feel like it's almost the majority of certainly founders, people who are looking to create these technologies, have a personal connection to diabetes. They have a child or a loved one who had diabetes that made them want to find a way to make it easier to manage. So yeah, that's extremely prevalent, I think, in the industry is people, because the condition is so common at this point, that so many people do have personal attachments to sort of technology, new and old, and how they want to improve on that and make life easier for people with diabetes.
I hear you. So, talking about making life easier for those with diabetes and sort of the improvements using your own sort of way of thinking, let's talk about what this year looks like. So you've been covering diabetes and for all of 2024. We're almost at the end of it. Can you give me some highlights, like stories that you've covered, conversations you've had? I mean, just lay it on me.
Yeah, this I was fortunate enough this year, this past June, to go to the American Diabetes Association Scientific Sessions. That was my first diabetes event, my first in-person diabetes event, and was able to meet with people from multiple companies and learn more about what they're doing, and that certainly was eye-opening to me. There's so many different sort of wrinkles to this. I can think of a few headlines off the top of my head. I mean, Medtronic and Abbott joining forces to sort of integrate their diabetes technologies, Abbott's CGMs and Medtronic's insulin delivery systems. I mean, those are just two of the biggest names in medtech in general and in diabetes as well. So that was huge. Both Abbott and Dexcom had over-the-counter CGMs approved by the FDA this year. So now people are able to purchase, CGMs through the pharmacy channel eventually, and through the companies, and that's obviously something that both companies saw as a vital way to get these technologies to people. And then yeah, it just general innovation. Companies are expanding on their technologies, their platforms, new insulin pumps, new connectivity capabilities. I know Insulet just announced that their Omnipod 5 iPhone app is finally out in the US, fully available. So that sort of opens up, the ability to control your insulin pump from an iPhone, changes the game for a lot of people. And yeah, no, so many different things, and I'm sure I'm forgetting some big bits of news, but quite
Well,
quite a
that's
few things to talk about.
yeah, I mean, that's why I'm here to help with that. So, do you have, how about this as a solution? Maybe you can send over your top 5 articles that you've written in 2024, and we can drop that here in the comments of our LinkedIn post. And anybody who's interested can follow those links to read Sean's coverage. So, if that works for that, we've provided that little gift for our
Definitely,
audience
definitely,
today.
definitely. There's going to be plenty of diabetes content this month.
Are you going to do a roundup article that actually summarizes some of your top stories?
There will be a roundup of that. There will be a roundup of what some companies are doing to recognize these sort of initiatives, or these pre-specified dates or months to raise awareness. I know Medtronic already announced their own Blue Balloon Challenge initiative, which they've been doing for the past few years. Insulet announced some different initiatives ahead of these specific dates, and I'm sure we'll have more. So there will be a comprehensive roundup of that as well.
Oh, excellent. So where can we find these roundups?
You can find them on Drug Delivery Business News, drugdeliverybusiness.com. It's where the majority of our diabetes coverage is. Some of it will also be over on MassDevice. There's also been some interviews I've done that are on medical design and outsourcing, so we like to share the wealth a little bit with diabetes. But Drug Delivery Business News is where you can find all of it.
Excellent. So last question for you, Sean. If you had to reflect in 2024, what were some of the buzzwords in your diabetes content?
Ooh, that is a good question. Connectivity is huge. I would say that's number one. People want their lives to be easier. They want technology to be easier to use. And obviously, there are people out there who don't want, all the bells and whistles, and they just want to inject insulin. But other people do want automated systems. They want them to be able to connect to all their different devices. So to have a pump full of, a life-saving therapeutic like insulin that connects to a CGM on your arm that is measuring your blood glucose, that connects to a phone that you can then track and, you know, direct your own pump. Yeah, and that's not new, but I would say sort of the capabilities, as I mentioned, Insulet connecting to the iPhone, and some of these companies are now pairing some next generation CGMs with the pumps. I know Insulet, Beta Bionics, and Tandem all announced new integrations this year. So, and then obviously the Medtronic and Abbott news as well. So connectivity and then integration, I would say, are some of the buzzwords.
Excellent. Any last thoughts?
No, I mean, I hope people want to learn more about diabetes as I have been lucky enough to do over the past few years. And, drug delivery business news isn't a bad place to start, I would say. But yeah, plenty of coverage to come, I would say. Yeah.
Excellent. Well, we really appreciate you raising awareness around the state of diabetes today, what the industry is doing to help move that health forward, help support patients and their caregivers. And please, once again, go to massdevice.com, medicaldesign&outsourcing.com, drugdeliverybusinessnews.com. Am I missing any, Sean?
That's probably a good place to start. Maybe we'll drop the rest in the comments if there's any other websites people need. But yeah.
Perfect. And then I'm going to volunteer you, Sean. So if anybody has any stories that they want shared around their diabetes technologies or what the future of diabetes can be, please reach out to Sean Whooley on LinkedIn. Sean, can you spell your last name for us?
It is Whooley, and for the sake of, because some people spell Sean differently, it is Sean is the first name. So
Perfect. So please connect with Sean. And as always, I'm going to be shameless and plug myself. Please connect with me, Kayleen Brown. My last name is just like the color. Kayleen is Kayleen. I'm with DeviceTalks. And thank you again, Sean, for joining me on this little chat.
my pleasure. Thank you.